You are listening to the Pregnancy Podcast with Vanessa Merton.
Oh, thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking all about ultrasounds. Ultrasound during pregnancy is one of the most common tools that your care provider uses to monitor your baby's health and development. Whether it's your first scan in the early weeks or the anatomy scan in the second trimester, ultrasounds provide valuable information about how your baby is growing. However, many expecting parents have questions about how many ultrasounds are necessary, how accurate the measurements are, and whether there are any risks. This episode will walk you through what to expect at each stage of pregnancy, from the first trimester scan to third trimester growth checks. Hear about the research on ultrasound safety, what professional medical organizations recommend, and how accurate ultrasounds are for estimating your baby's size. Plus, we'll cover 3D and 4D ultrasounds as well as home Dopplers and what happens when an ultrasound reveals something unexpected. You can find the full article and all of the resources for this episode at pregnancypodcast.com/ultrasound. You are currently listening to the public feed of the podcast. Become a Pregnancy Podcast Premium member so you never have to hear ads and get access to hundreds of evidence-based episodes that you will not find on the public feed. Check it out at pregnancypodcast.com/premium. Zoller goes above and beyond in formulating their prenatal plus DHA. They use high-quality ingredients like the active form of folate, bioavailable iron, and essential nutrients like omega-3s. In March of 2026, save 30% off the Zoller Prenatal Plus DHA on Amazon with the code PREPODHA30. Plus, if you email your order number and mailing address to vanessa@pregnancypodcast.com, Zoller will send you a free silicone baby bib. And you can always see the current promo code for the Zoller Prenatal Vitamin at pregnancypodcast.com/vitamin. If you are looking to prevent stretch marks during pregnancy, Centella Asiatica is a clinically studied ingredient shown to help prevent stretch marks in up to 89% of women. The True Belly Serum from 8 Sheep Organics is formulated with 85% Centella Asiatica extract. You can try it risk-free for 100 days if you are not 100% happy with your purchase. 8 Sheep will send you a refund, no questions asked. Check out 8 Sheep Organics and save 10% when you go to pregnancypodcast.com/8sheep. Ultrasound technology was invented in Glasgow in the 1950s, and it was adopted by British and American hospitals in the 70s. An ultrasound exam uses high-frequency sound waves to create images of your baby and the placenta. The handheld part of the machine is called the transducer. This emits sound waves at a specific frequency and then captures the returning echoes. Different tissues, fluids, structures all reflect waves at varying speeds depending on their density. Then a computer converts the reflected sound wave patterns into a visual image called a sonogram. Although you'll often hear the terms ultrasound and sonogram used interchangeably, they are technically different, but they do refer to the same exam. In order for an ultrasound to work, a water-based gel is applied to your belly. That gel creates a tight bond between your skin and the transducer, and that allows sound waves to transmit directly to the tissues beneath your skin. Without the gel, all you would see would just be a black screen. This gel is usually very cold when they apply it to your belly, and once they do that, the technician or your care provider, whoever is doing the ultrasound, will place the transducer on your belly. The sound waves bounce off bones and tissue and then return to the transducer to generate a black and white image of your baby on the screen. When the ultrasound is over, you can wipe the gel off, although it may leave your belly a little bit sticky. A bonus of getting an ultrasound is that you should receive a picture of your baby to take home. Depending on the purpose of the ultrasound and who performs it, you may need to wait for complete results once your doctor or midwife or a specialist has reviewed the scans. There are several types of ultrasound exams, and you may encounter more than one during your pregnancy. A transvaginal ultrasound uses a specially designed probe that gets inserted into the vagina. This is most common in early pregnancy because your uterus is still deep in the pelvis, and a transvaginal approach provides a closer, clearer image. A standard transabdominal ultrasound is the traditional exam where the transducer is moved across your belly to generate 2D images. This is the most common type and probably what you picture when you think of a pregnancy ultrasound. There's also a Doppler ultrasound. That measures slight changes in the frequency of sound waves as they bounce off moving objects like blood cells. This allows your care provider to assess blood flow in the umbilical cord, the placenta, your baby's brain. Doppler ultrasounds are more commonly used in higher risk situations. You also have fetal echocardiography that uses ultrasound waves to assess your baby's heart anatomy and function and can help evaluate suspected congenital heart defects. And your care provider may also use a 3D or 4D ultrasound to examine suspected fetal anomalies in greater detail. That provides a much more detailed picture. In the first trimester, your first appointment is usually around week 8 and typically will include a transvaginal ultrasound. This scan confirms cardiac activity to verify that yes, you are in fact pregnant, and will measure the crown to rump length of your baby to date your pregnancy. As a side note, the Society of Radiologists in Ultrasound published a consensus statement in 2024 recommending that the term cardiac activity rather than heartbeat is used for first trimester scans. This is because cardiac development is a gradual process, and the heart chambers are not fully formed in the first trimester. So you may hear your care provider use the term heartbeat, they may use the term cardiac activity. A transvaginal scan can also diagnose ectopic pregnancies. That happens when a baby is implanted outside the uterus, or a molar pregnancy where tissue that would normally become a fetus instead becomes an abnormal growth. If you have an ultrasound before 8 weeks and there is no cardiac activity detected, I do not want you to panic. Placental placement or your baby's position can make it challenging to pick up a signal this early. This is one of the reasons that care providers generally do not schedule your first appointment until about week 8. You know that the accuracy of your due date is crucial because it drives the timing of everything in your prenatal care, from when you take tests to recommendations to induce labor. Your doctor or midwife will primarily use the date of your last period to determine your due date. If a due date has already been established based on your last period, they usually won't change that date based on the results of an early ultrasound. You should note that before 14 weeks, the accuracy of gestational age from that measurement of the crown to rump length is plus or minus 5 to 7 days. So there is a margin of error there. Research shows that early ultrasound estimation of gestational age tends to increase the reported preterm delivery rate compared with estimation by the date of the last menstrual period. In a study of over 44,000 women, they found that early ultrasound measurements tended to skew gestational age earlier, which resulted in more preterm birth diagnoses. If your care provider uses ultrasound to date your pregnancy, early measurements tend to be more accurate. There's a few tests that you can encounter in the first trimester that include an ultrasound. A first trimester screen combines an ultrasound with a blood test. This takes place between 10 weeks and 13 weeks, 6 days. This can identify risk for specific chromosomal abnormalities, including trisomy 21, which is Down syndrome. It is important to remember this is a screening test, and a positive screening test does not mean that your baby has an abnormality. A screening test only gives you the likelihood of a condition. You would need a diagnostic test to diagnose anything. If you have questions about prenatal testing, that is a very confusing topic. I do have a full guide to prenatal testing, and I will link to that in the article for this episode. There are also diagnostic tests, including a CVS and an amniocentesis, that use ultrasound guidance during the procedure. In a CVS, an ultrasound guides a thin catheter or needle to the placenta to collect a tissue sample. In an amniocentesis, an ultrasound guides a needle through your abdomen into the amniotic sac. Both of these procedures require ultrasound guidance. The ultrasound allows your care provider to visualize where the needle is going in real time, and that is essential for the safety of these tests. One of the most anticipated appointments during your pregnancy is the anatomy scan ultrasound. This typically takes place between 18 and 22 weeks. This is the one exam that the American College of Obstetricians and Gynecologists recommends for all pregnancies. Typically, even mothers who are opting for a pregnancy with little or no intervention tend to still opt into this exam. This is a very thorough scan where an ultrasound technician, called a sonographer, examines all of your baby's major organs and structures in detail. During the anatomy scan, the sonographer will measure your baby from crown to rump, around their middle and their head. Because this is an anatomy scan, they will look specifically at the 4 chambers of the heart: kidneys, bladder, stomach, brain, spine, and sex organs. They will also evaluate the umbilical cord, amniotic fluid levels, placental location, and the fetal heart rate. This ultrasound can give a lot of data. It can diagnose fetal malformations and structural abnormalities. It can verify dates and growth. It can identify issues with amniotic fluid and overall evaluate your baby's well-being. Here's a few things that you should know ahead of this appointment. The anatomy scan can take 30 to 45 minutes or longer, depending on your baby's position and whether the sonographer can get all of the images that they need. If your baby is not cooperating, they may ask you to walk around, drink some water, or even come back for a follow-up scan. That doesn't necessarily mean that anything is wrong. It just means that the sonographer could not capture all of the required views. If you have an anterior placenta, that means that your placenta is attached to the front wall of your uterus. That can make imaging a little bit more challenging. An anterior placenta can also affect when and how strongly you feel your baby move, because it's cushioning those kicks or pokes or jabs from your baby pushing onto your stomach. The anatomy scan is especially exciting because for most parents, that's when they find out their baby's sex. If you choose not to find out, make sure that you tell the ultrasound technician up front. A systematic review and meta-analysis found that ultrasound accuracy for determining sex rises from about 87% in the first trimester to 99% in the second and third trimesters. By the time of your anatomy scan, that accuracy is very high. That said, factors like your baby's position can occasionally make it difficult to get a clear view. You may want to ask how confident the technician is. And of course, the only way to be 100% sure is to wait until your baby's born. I always recommend that partners attend every prenatal appointment. It's a really fantastic way for them to hear everything firsthand, to ask their own questions, and to be involved with you throughout your pregnancy. While it would be amazing if your partner can make every appointment, the anatomy scan ultrasound is one of the more important ones for them to attend. This is an exciting appointment, and it's a time when you may receive new information or have questions, and having your partner there means that you're not processing all of that alone. Most ultrasounds come back normal. However, sometimes they will reveal findings that require further investigation, and it helps to understand what these findings can look like so that you're prepared in the event this happens. Some findings are clearly significant and will prompt immediate follow-up, something like a structural abnormality in the heart or the spine. In those cases, your care provider may refer you to a maternal fetal medicine specialist for a more detailed scan and to talk about your options. Other findings fall into a gray area. These are often called soft markers and are minor variations that can be seen on an ultrasound. Examples of this include an echogenic bowel. This means that a section of the intestine appears brighter than expected on the ultrasound. A choroid plexus cyst, that's a small fluid-filled space in the brain that is almost always harmless, although it does sound scary. Or something like an echogenic intracardiac focus. Sounds terrifying, right? That's a small bright spot on the heart that typically does not affect heart function. In most cases, isolated soft markers are normal variants that resolve on their own and have no impact on your baby's health. However, it can be unsettling if something like that is found in an ultrasound. A study that looked at anxiety following ultrasound exams found that indeterminate findings, especially incomplete exams, were associated with significantly higher anxiety despite an overall good prognosis. Of 286 ultrasounds in this study, 40.5% were indeterminate, meaning that they were either incomplete or showed minor findings of uncertain significance. Indeterminate results were more common with obesity and increasing gestational age, with the majority occurring in the third trimester. Research also shows that even when soft markers are ultimately resolved and the baby is healthy, that experience of receiving uncertain findings can increase maternal anxiety and even affect early bonding. If your ultrasound comes back with an unexpected finding, please try not to jump to the worst case scenario. Ask your care provider to explain what the finding means, what the next steps are, and whether further testing is recommended. In many cases, a follow-up ultrasound or a referral to a specialist will provide clarity. If you find yourself in that waiting period, you should know that the vast majority of these findings ultimately have no impact on your baby's health. In the third trimester, ultrasounds are used a little bit differently. They can be used to evaluate the location of the placenta, to observe your baby's position, monitor fetal movements, assess amniotic fluid levels, and estimate your baby's size. Not all pregnancies will include a third trimester ultrasound, and whether one would be recommended or offered by your doctor or midwife depends on their practice and your specific circumstances. There is an ongoing debate about whether routine third trimester ultrasounds should be standard for low-risk pregnancies. A Cochrane review assessed the effects of routine late pregnancy ultrasounds after 24 weeks. It concluded that routine late pregnancy ultrasound in low-risk or unselected populations does not confer a benefit to the mother or the baby. However, critics of this review have pointed out that many of the included studies were decades old and do not reflect current ultrasound technology. A rebuttal was published in the British Journal of Obstetrics and Gynecology that argued that in developed countries with advanced ultrasound technology, there is no reason not to offer this exam routinely. The authors cited examples of fetal anomalies like congenital heart defects or microcephaly that may only be detectable in the third trimester. Currently, it is not routine to have a third trimester ultrasound in the United States, and this remains an unresolved question in obstetric care. That could change in the future, and your care provider's approach will depend on the evidence that they find most compelling and the specifics of your pregnancy. One use of ultrasound in the third trimester is a growth scan. Guidelines were updated for the timing on this in 2024. They recommend if you are screening for a small for gestational age baby or a large for gestational age baby in the general population that it should be done at 36 weeks. It was previously done earlier, and they found that screening at 36 weeks is more accurate. Your care provider may also recommend a third trimester ultrasound if you have risk factors for complications. This could include gestational diabetes, high blood pressure, concerns about your baby's growth, or questions about amniotic fluid levels or placental position. One of the most common questions about ultrasound during pregnancy is how accurate the size measurements are. And this comes up especially in the third trimester when your care provider may estimate your baby's weight using an ultrasound. Understanding how these estimates work and their limitations can help you put the numbers in context. The only way to estimate your baby's weight before birth is by plugging measurements from an ultrasound into a formula. There are 4 key measurements that are typically taken: head circumference, biparietal diameter, that's the width of your baby's head, abdominal circumference, and femur length. These measurements are entered into algorithms that estimate a weight. The accuracy of that estimate depends on what formula is used, the skill of the person that's performing the scan, and your baby's position during the exam. One study found that ultrasounds were accurate within 10% of the actual birth weight about 84% of the time. Another study found that mothers predicted their baby's weight within 10% in 59% of cases and found ultrasounds were accurate within 10% in 65% of cases. In this study, mothers were almost as accurate as ultrasounds at estimating the weight of their baby. Both of these studies are consistent with broader research showing that ultrasound weight estimates have a very considerable margin of error. To make things even more challenging, there's no universal formula to convert ultrasound measurements into weight. One study examined several commonly used formulas and found that all of them overestimated or underestimated fetal weight. Researchers concluded that ultrasound estimated fetal weight should be interpreted with caution, especially for babies suspected of being small for gestational age. Using fetal growth percentiles is one way to compare your baby's measurements to a reference population of babies at the same gestational age. So on a scale of 0 to 100%, the 50th percentile represents the median. So half of the babies will measure above that, half below. ACOG considers newborns with a birth weight below the 10th percentile to be small for gestational age, and large for gestational age is generally defined as a birth weight at or above the 90th percentile. Unfortunately, there's no universal agreement on these definitions, and some researchers have proposed using the 15th and the 97th percentiles as more clinically meaningful cutoffs. A study that examined third trimester ultrasounds to evaluate small for gestational age babies found that they were not very accurate. Ultrasounds missed the diagnosis of many small for gestational age newborns. The researchers warned that routine screening in a low-risk population may lead to unnecessary planned preterm delivery and elective cesarean sections for babies who are actually not below the 10th percentile. On the other end of the spectrum, a study examining over 26,000 pregnancies with ultrasound between 35 and 38 weeks found that 8.6% of the time, the ultrasound falsely identified a baby as large for gestational age when they were not. Ultrasounds were more accurate at predicting large babies when the scan was specifically ordered because a large baby was suspected. This is a theme that we see with a lot of interventions. When screening tools that are designed for specific indications become routine for everyone, they can generate results that are not always accurate and could potentially lead to unnecessary interventions. If your care provider tells you that your baby is measuring large or small, it's reasonable to ask about the margin of error, ask what the next steps are, and whether any recommended interventions are necessary based solely on that measurement. The last third trimester ultrasound we'll cover is the biophysical profile. If a question about fetal health and well-being arises during your pregnancy, or if your pregnancy is considered high risk, your care provider may recommend a biophysical profile. This test can take place after 32 weeks, and it combines an ultrasound with a non-stress test. The non-stress test part of it is belts are placed around your belly, and they measure your baby's heart rate and any contractions. The ultrasound portion of the biophysical profile is evaluating 4 things: your baby's body movements, muscle tone, breathing movements, and the volume of amniotic fluid. Each of those 4 areas is scored on a scale of 0 to 2, and then the non-stress test adds another 0 to 2 points for a total possible score of 10. A score of 8 to 10 is generally reassuring. A lower score may prompt additional monitoring or, in some cases, a discussion about moving up the timing of your delivery. The biophysical profile gives your care provider a more detailed picture of your baby's well-being beyond what a standard ultrasound alone can provide. Next, we're going to talk about how many ultrasounds you should have and really dig into the evidence on safety. Before we do that, I would like to thank the sponsors that have supported this episode. A lot of companies have exclusive discounts for pregnancy podcast listeners, and you can always see discounts and promo codes at pregnancypodcast.com/resources. Not all prenatal vitamins are created equal. Zoller goes above and beyond, using the latest scientific research to formulate their prenatal plus DHA with high-quality bioavailable ingredients. The Zoller Prenatal Plus DHA is sourced directly from nature, containing pure, unadulterated ingredients to meet the highest standards. This vitamin is carefully formulated with the nutrients that you and your baby require in the optimal ratios for absorption, metabolism, and safety. One of my favorite things about the Zoller Prenatal is that it contains omega-3s like DHA. Very few prenatal vitamins include this, and your DHA levels directly impact the central nervous system and the cognition of your developing baby. With 300 milligrams of DHA included, this is one less thing you need to think about. In March of 2026, save 30% on the Zoller Prenatal Plus DHA vitamin on Amazon with the code PREPODHA30. Plus, if you email your order number and mailing address to vanessa@pregnancypodcast.com, Zoller will send you a free silicone baby bib. You can always check for the current promo code at pregnancypodcast.com/vitamin. Let's get back to today's episode. How many ultrasounds should you have? According to ACOG, you should have at least one standard ultrasound during your pregnancy, typically at 18 to 22 weeks. That's the second trimester anatomy scan. For many pregnancies, it's common to have 2 ultrasounds, one early on to date your pregnancy, and then the anatomy scan in the second trimester. However, the actual number of ultrasounds varies widely depending on your care provider's practice and your individual circumstances. A study published in the Journal of Ultrasound in Medicine analyzed over 1.7 million pregnancies with commercial insurance between 2016 and 2022. They found an average of 5.3 ultrasounds per pregnancy. Utilization increased over the study period and was higher among older mothers and those with additional risk factors. Many healthy pregnancies do not technically require that many ultrasounds, and professional organizations recommend an ultrasound only when medically indicated. However, in practice, in the real world, very few expecting parents are going through pregnancy without at least a couple of scans, and this data shows us that that number is even higher. More ultrasounds are not necessarily better. While each individual scan provides information, the more frequently ultrasounds are performed, the more likely you are to receive inconclusive or indeterminate results. And like we talked about, indeterminate findings can cause significant anxiety, even when the prognosis is ultimately good. If your care provider recommends an additional ultrasound, it's always reasonable for you to ask why it's being recommended and what information it will provide. Next, let's talk about safety. Overall, ultrasounds have an excellent safety record. They've been used in obstetrics for decades without proven harmful effects in humans. The American College of Obstetricians and Gynecologists states that currently there is no evidence that ultrasound is harmful to a developing fetus. No links have been found between ultrasound and birth defects, childhood cancer, or developmental problems later in life. However, ACOG also notes that it is possible that effects could be identified in the future, and for this reason, ultrasound should be performed only for medical reasons by a qualified healthcare professional. The FDA cautions that ultrasound can heat tissues slightly, and in some cases, it can also produce very small bubbles called cavitation in some tissues. The long-term effects of tissue heating and cavitation are not fully known. And for this reason, the FDA sides with ACOG and says that ultrasound should be performed only when there is a medical need and by appropriately trained operators. The American Institute of Ultrasound in Medicine advocates for a conservative approach that obtains the necessary diagnostic information at minimal exposure. They strongly discourage the non-medical use of ultrasound and state that using ultrasound without a medical indication to view the fetus, to obtain images, or identify the sex is inappropriate and contrary to responsible medical practice. They recommend that all fetal ultrasound exams be performed by appropriately trained and credentialed medical professionals who have specialized training in fetal imaging. This is important because these individuals are trained to recognize medically important patterns and to use techniques that minimize unnecessary exposure. It is worth understanding the ALARA principle here. This stands for as low as reasonably achievable. This principle guides how ultrasound operators approach each exam. The goal is to use the lowest possible ultrasonic exposure settings that are necessary to get the diagnostic information that they need. Modern ultrasound machines have built-in safety features, and they will display thermal and mechanical indices that help operators monitor exposure levels in real time. Now that you know where all of the major medical organizations in this field fall, let's talk about some actual studies. Because it would be unethical to expose pregnant women or their unborn babies to potential harm in a controlled study, there isn't direct human research on ultrasounds. Instead, we have animal studies. These provide the best available evidence to explore possible effects. One study applied 30 minutes of diagnostic ultrasound to pregnant mice at embryonic day 14 and then studied the social behavior of their male pups 3 weeks after birth. Ultrasound-exposed pups were significantly less interested in social interaction than pups that did not undergo ultrasound exposure. In simple terms, these results suggest that fetal exposure to diagnostic ultrasound can alter typical social behaviors in young mice. Of course, there are significant differences between mice and humans, and that would require much more exploration before any changes in clinical practice. Primary takeaway from this study is that more research is needed. There's also an animal study that investigated whether ultrasound exposure of a chick's brain can lead to learning memory and impairment after hatching. Researchers exposed the brains of chicks on day 19 of a 21-day incubation period for 5 or 10 minutes of ultrasound. Researchers exposed the brains of chicks on day 19 of a 21-day incubation period to 5 or 10 minutes of ultrasound or to 1 to 5 minutes of pulsed Doppler ultrasound. Standard ultrasound exposure did not affect memory function. However, pulsed Doppler exposure caused significant memory impairment in chicks that were exposed for 4 to 5 minutes. This is relevant because Doppler ultrasound uses a higher acoustic output than standard imaging. When ultrasound waves are traveling through tissue, that energy gets absorbed and converted to heat, which all depends on the frequency and the intensity. So this study really reinforces the importance of the ALARA principle, particularly for using a Doppler. Of course, animal studies do not directly translate to human outcomes. But these studies are the best available evidence that we have. They don't prove any harm to human babies, but they do support the recommendation that ultrasound should be used prudently and only when medically indicated. This is all very great background information to talk about 3D, 4D, and even 5D ultrasounds. A standard ultrasound generates a flat 2D black and white image. A 3D ultrasound combines multiple images from different angles to create a still three-dimensional image that shows much more depth and detail. A 4D ultrasound is similar to 3D, but it includes real-time motion so that you see a live video of your baby moving in 3D. Some elective ultrasound clinics now offer 5D ultrasounds. Despite the name, 5D does not actually add another dimension. These are simply higher quality and more realistic images that are produced with updated software. It's possible that your doctor or midwife would recommend a 3D ultrasound for medical reasons, like further evaluating a suspected fetal anomaly like a cleft lip or an issue with the spinal cord that could have been flagged on a standard 2D scan. If you do get a medically indicated 3D ultrasound, you can absolutely request pictures from that. Most 3D and 4D ultrasounds are not prescribed by a doctor. They are elected by parents who want to see their baby and then get keepsake photos or videos. That appeal, completely understandable. You get to see a somewhat realistic view of your baby's appearance before they're born. It can be fun to see what facial features they have. And for many parents, seeing their baby provides reassurance and can help them bond. If this is something you're going to do, the best timing for keepsake 3D or 4D images is generally between 26 and 30 weeks when your baby has developed enough fat under their skin for detailed features, but still has enough room to move around. However, the consensus from professional medical organizations is against elective ultrasounds for keepsake purposes. As we talked about, the American Institute for Ultrasound and Medicine, the FDA, ACOG, all recommend that ultrasound should be used only when there is a medical indication. The concern is not that a single elective ultrasound has been proven harmful. The concern is that the long-term effects are not fully known. And exposing your baby to ultrasound energy without a medical reason does not align with the precautionary approach that these organizations recommend. If you decide to move forward with an elective 3D or 4D ultrasound, that is absolutely your choice and something you can do. Do choose a reputable business. Look for a company whose sonographers are registered by the American Registry for Diagnostic Medical Sonographers or who are accredited by the AIUM. Health insurance does not cover elective ultrasounds because they're not technically medically necessary. Packages are pretty affordable. Generally, they range between $100 and $200. Prioritize going to a place with a really good reputation and credentials over saving money. You also always have the option to opt for a shorter session to limit your exposure. We talked about Dopplers. There's also home Dopplers. Those are a handheld device that are marketed for individual use that use ultrasound to detect and amplify your baby's heartbeat. It's completely natural to want reassurance that your baby is okay, especially between prenatal appointments that are spaced far apart, and especially in early pregnancy when you can't feel any movement. However, there are some important considerations to keep in mind if you are considering purchasing a home Doppler. The first is that these can be difficult to use, especially before 14 to 16 weeks when your baby is still very small. If you can't find the heartbeat, that's going to create far more anxiety than relief. There's also a risk of false security. Dopplers can pick up a lot of sounds that are not your baby's heartbeat, including your own heartbeat, placental blood flow, or movement noises. Mistaking one of these for your baby's heartbeat could provide false reassurance if something is actually wrong. The FDA extends these same cautions about tissue heating and cavitation to home Doppler devices and recommends that ultrasounds be used only when there is a medical need and performed by trained operators. If you're looking for reassurance between appointments, there are other ways that you can feel connected to your baby that don't involve ultrasound energy. As your pregnancy progresses, you will have more and more natural cues that your baby is doing just fine. By about week 16, you may begin to feel flutters from your baby. These are often described as if a butterfly were flapping its wings. By week 20, you should be able to feel substantial movements like pokes and kicks or your baby moving around. These movements will become a regular and natural form of reassurance as your pregnancy continues. By about 23 weeks, your care provider should be able to hear your baby's heartbeat with a standard stethoscope rather than using a Doppler. Unlike a Doppler, a stethoscope doesn't emit any ultrasound energy, so it doesn't carry any of the same concerns about heating tissues. Potentially, this is also something that you could do at home if you had a stethoscope, although it could take some practice to locate the heartbeat on your own. If you are considering a home Doppler, please discuss it with your doctor or midwife. This should never be a substitute for medical care, and you should always contact your care provider if you have concerns about your baby's well-being, regardless of what you hear on a Doppler. Ultrasounds, like all procedures during pregnancy, are a choice that should come with informed consent. And a key part of informed consent is that you always have the option to opt in or to opt out. If your care provider recommends an ultrasound, you can ask questions like what information will it provide, what will happen if you decline it, and whether there are other alternatives. For dating your pregnancy, if you know when your last pregnancy was, your care provider should be able to estimate your due date without an ultrasound. For prenatal screening, there are tests like a cell-free DNA test or an NIPT test that use a simple blood sample with no ultrasound required to detect chromosomal abnormalities. There is a lot of nuance into which prenatal tests will be most appropriate for you, and your care provider can help you navigate those options. The takeaway on ultrasound safety is pretty straightforward. When it's used for medical purposes by trained professionals, this has an excellent safety record with no proven harmful effects. Professional organizations recommend using this only when medically indicated and with the lowest possible exposure. So whether you choose to have every recommended ultrasound or you prefer to minimize those scans, the important thing is that you're making that decision in partnership with your doctor or midwife based on the individual circumstances of your pregnancy. Your doctor or midwife is really the best resource for understanding which ultrasounds are recommended for your pregnancy and why. If you have questions about the purpose of an ultrasound, the expected findings, what your options are, please bring those up. If your ultrasound reveals any unexpected findings, don't hesitate to ask for a clear explanation of what was found, what it means, and what the next steps are. You can always ask for a referral to a specialist if you want a more detailed evaluation. You and your care provider have the same goal, and that's to keep you and your baby safe while supporting the birth experience that you want. So hopefully in this episode, you have a lot more information to have an informed conversation about your preferences and how different ultrasound options may fit into the pregnancy experience that you want. To recap today's episode, we started with the basics of how ultrasound works and the types of ultrasounds that you may encounter. We walked through what to expect in each trimester, starting with a transvaginal ultrasound and then moving to the anatomy scan in the second trimester. That is one of the most detailed and exciting appointments. We also covered third trimester ultrasounds, the ongoing debate as to whether those should be routine for low-risk pregnancies. I spent some time discussing research on the accuracy of ultrasounds for estimating your baby's size, including how those measurements are calculated, fetal growth percentiles, and the margin of error that's associated with these estimates. We also covered what happens if an ultrasound reveals something unexpected, including soft markers and indeterminate findings. We reviewed research on ultrasound safety, talked about some animal studies, recommendations from the FDA, ACOG, and the AIUM. Then I talked about 3D, 4D, and even 5D ultrasounds and what to consider before purchasing one, and then wrapped up talking about weighing risks and benefits and why it's so important to discuss your options with your care provider. I'd like to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. You can read the full article and see all of the resources, links, everything for this episode at pregnancypodcast.com/ultrasound. Today, I covered a lot of ground on ultrasounds. And there are hundreds more episodes with evidence-based information on every topic you can think of for pregnancy, birth, and postpartum. The research in those episodes is just as useful today as the day that it was published. And premium members get all of it ad-free. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium.